Told you I was going to throw that in there. And it's not so much just about sign here, pay here. And sure, it is an investment and talking about the investment. And they don't park their teeth in the garage at night or out in front of their double wide. Right? And then what does it look like for the runway for 4, 6 months from now, 8 months from now, 12 months from now? I love it. We're going to link arm in arm and take over every alley in dentistry.
Hey everyone, thank you so much for coming back to DentMed Podcast. Man, on this episode, we already had so much conversation before we start.
There was a pre-podcast before the podcast.
I know, pre-pod.
Little pre-show. Appetizer podcast.
We got Mr. Greg Essenmacher. Is that right?
Oh, that was perfect. Thank you, Dr. Owji. Appreciate that.
Please
I told you I was going to throw that in there.
Please don't.
I won't, Milad. I just had to throw that in there because we talked about that.
This doctor stuff is all fake.
Yeah,
it's
you
all
can
for
buy
sure.
that certificate in a weekend.
Cost you about $9.99.
And there's a decimal point after the first 9. You got a 10 spot? You can get one.
Yep.
Tax-free.
I know, man. Well, I wish it was $9.99. That damn thing cost
I told you it's going to go off the rails. I warned you before. Like, there's no boundaries. There's no rules if we're going to have this conversation today.
Hey, I love it, man. We gotta sometimes go off the rail. You know, that's what life is about.
Right? I mean, dentistry is serious, but the dental industry, we really have to be a little lighthearted about it, right? You know, taking care of patients is a serious thing, but we can certainly have some fun while we're doing it. And that's all about the patient experience for sure.
Yes, and that's what I love about it, man. We get on here, we have fun, we joke around, we give some information to people, and then we'll make some differences and we'll go from there. Well, Mr. Greg, before we get started, so go ahead and tell our audiences who you are, what you do, what you're about. Tell us about your experiences in our dental industry. Tell us about your company. Tell us about all the great things and the travels that you're doing.
Yeah, absolutely. And you told me like at least 15 minutes of an intro, so everybody shuts off the podcast and nobody listens. So start the clock now, like put it up in the corner in post-production. I'm teasing, of course. So yeah, I've been in the industry for 18 years. 11 years ago, I was one of the first employees over at Neodent, part of the Strawman Group. We launched that value brand into the market. It was just amazing, right? I learned so much in that experience. 3.5 years ago, because we really focused at Neodent on building out the full arch brand for a lot of practices, adding it to, especially in the single house provider, a lot of the GPs that were adding full arch in. 3.5 years ago, I decided that, you know what, I'm going to hang my own shingle, start my own business and brand. As much fun as that can be, learned a lot and have been learning a lot. And we really do two parts of the business at G&A Consult. We do the teach, coach, and train side, every touch point of that patient journey, from converting the lead calls into consultations that actually patients that show up. And then, of course, converting those consultations into starts, into arch starts, fixed full arch starts. And we also work in that same vein with the dental assistants to level up their skills, to take some of the burden off of the clinicians so they can focus strictly on what they're doing, which is delivering that excellent patient experience. Then on the operations side, it's really all about optimizing those operations, and that's peeling off the P&L for the full arch side. So it's not just the, oh, look, $30,000, $40,000, $50,000 top line revenue, but how profitable is that? Because the vast majority of our clients have both and. They have a thriving GP side of their practice, and full arch is an auxiliary service, and they want to grow that piece. So where is it that it really influences all the rest? Because when one lever changes, all the rest changes. And when is it time to, as they build and grow those arches, is it time to add personnel into the mix on that micro team? And we do that in scheduling optimization and all those things. So in a nutshell, that's what we do at G&A Consult. That's who I am and why I think you invited me on. Either that, it's for the dad jokes, because I've got tons of those too, and we can talk about that.
I think it was mainly for the dad jokes.
Is it? Okay. All right. I can bust some of those out for sure. I get called out in socials all the time for the dad jokes. And they're not good. I'll just admit it. And now I'm going to have granddad jokes soon. I mean, July, I have my first grandson coming. So they'll just get worse, not better.
I'm all for it. I was watching, there's a YouTube channel that there are a bunch of guys out in Australia, and that's all there's. They just sit around the table and they all make dad jokes, and they're just so corny.
Love them. The cornier, the better. They're just so. The problem is I forget more than I hear. Right? As soon as I hear them, I'm like, that's a really good one, and I'll forget it. So it's really just my natural state of being for sure.
Maybe we should make one for the dental industry. I was telling kids sit around the table and make corny jokes.
You shouldn't have said that out loud. We got to do this now. We got to launch it before you publish this. So I don't know how soon you're going to publish. We got to get on this. I love it.
Dental Industry Corny Jokes Podcast.
Dental Dad Pod Jokes. DDPJ. DDPJ. All right. So dental dads putting on their PJs. We could dress up in pajamas. That could be like the uniform. I think we're onto something here. I think we're right. It looks like Masood is actually wearing pajamas today for the podcast. So I think like he was actually had a premonition to wear what he was wearing. And he said he doesn't talk much and he's not the funny one. So I think we're onto something here.
Masood is actually pretty funny. I think he's shy today.
Yeah, I'm so shy in front of you. That's the first question I was going to ask you, Greg. Not everyone in the industry is funny. How are you so funny? Especially Milad. He tries to be funny, but,
I think probably part of it comes from being the youngest of 6 kids and being beaten down so much. And if I could use humor to be able to avoid like getting a beat down every once in a while, I think it probably started there. It might be a defense mechanism, of being, that shy kid. Because when I was growing up, I was that shy kid. And I was a gay kid growing up too, right? And so to mask that, because I wanted people to like me and the people pleasing, just to get a little serious, I think part of that. Now as an adult, well, I act like a kid sometimes, but as an adult, I really think like humor and laughter really is the best medicine. And I really like to see people enjoy themselves. And for me, it's really about having a good time. Sure, business is serious, like being productive and being profitable and being able to help clients is a serious thing. But helping along the way, and I was a corporate sales trainer before I got into dental for a rental car company, and if you can gamify it, like for me everything is about gamifying. If I have a list of tasks, I'll be miserable in it, but if you gamify it, like I'll have fun with it, I'm going to do it and enjoy it. And I think it's the same for most people. If you can have some fun with it, it doesn't feel like a burden, they actually enjoy it. And if you want to be remembered, be memorable. And that's what I learned too. And I think I take that to the stage and on podcasts like this and just people that I meet and, spread a little joy and a little love in the world. Isn't that what it's all about?
Yeah. So you're a player. That's what you're saying.
I have to be careful because my husband's going to see this. And if you say that, he's going to be like, wait a second, hold on a second. Masood just asked me if I was a player. No, not in that sense. Whatever path you're going down, we were just talking about pajamas and now you're asking me if I'm a player. No. Just like I say to my dogs, no. Milad, save us here. I don't know what he's doing. Like, what path is he trouncing down? Like, this is not the yellow brick road, right? I mean, this is like Wicked 2. I don't know what's going on, okay? So save us from ourselves.
Yeah, I know. Masood always takes us down those wrong roads. I'm like, wrong direction.
Divergent. Back it up. Beep, beep, beep.
We need to come back to
what
the
is this about dad jokes?
Let's come back.
Dad jokes were much safer. Safer.
Let's go back and talk about dental and stuff. Let's talk about full arch.
Let's talk about teeth.
We can get into that and stuff later, Master. Mr. Greg, so for the, I know that in our industry, I mean, especially in dentistry now, I think the full arch has become a game changer for the patients. How has it been? I mean, in my practice, we certainly talk about, the implants, and we talk about to the patient, I'm like, hey, dentures, they suck. Without it, they suck. They don't function. They never work. I would highly recommend every patient that wants a denture to, get implants, like 2 on top, 2 on the bottom, snap them, and that's it. That bad boy is going to rock. How do you think that like with the offices you work with, how do you think those has impacted the patient? Like, what are the patient's feedback has been? Based on your experience, like what are the patients happy with the result that they get with the full arch? Are the doctors are happy with the result that they get? And what is that process for you to see if the patient are satisfied with the result of their essentially surgery?
Yeah, I love that. And I talk a lot, especially when I'm speaking with clinicians or from the stage or with dental teams, about the triangle of success. And for your question of what you're talking about, it really is the triangle of success with patients, right? For me, it was very early on in full arch. I was maybe with Neodent a couple of months. And so this would have been early 2014, right after we launched the brand. And it it was a patient reveal it was really emotionally moving to me. Now, I didn't know at that time that'd be like, I'm going to be in full arch forever. It really wasn't that type of situation, but it did impact me. And slowly it started to make a huge difference. And I've been in the operatory for over 1,000 full arch surgeries. And so I know the impact that it can make. And it's not every patient reveal that's like that. Sometimes, they're just coming out of anesthesia and you put a temper and and that's the majority of them. It doesn't really happen with all of them. But the impact that it makes really goes back to before, when you're doing the consultation, right? Because ultimately, look, businesses are in business to make money. Let's just call it that. That it's not dirty to talk about selling, but that case acceptance piece really comes to patient experience, and it's driven by patient experience. And what I mean by that is the product has to be good. The what? That's the product. You have to deliver a good product. So let's just set that aside. So it's not so much the what, but patients are driven by their why. Why is it now that, Jenny, you know what, you've had a bombed out mouth for 20 years. You've had this situation for a long time. Or you have another group of patients where, you know what, they've had, this situation where they've had the root canal and a crown, and now they've got a partial on the other side. And now they've got a chipped tooth, all on the lower, right? All on the mandible. And now, Jenny, it's time. Let's just do one permanent solution for that. So these are the types of situations. So it's the motivation, the why now. And getting to that why is really what we work with practices on, of getting and understanding the why. If you're just delivering the what and the product and the price, and you have all these objections, you really haven't gotten to the motivation. And that really is where you're asking me that question, because what is the impact? It's delivering the motivation. It's being able to satisfy the motivation, right? The easy ones are, my daughter's getting married in 6 months and pictures are forever. I'm not talking about those. There's some real subtleties that are extremely difficult for patients to actually articulate. It might be that, they've been married for 25, 30 years and they don't go out to eat anymore with their spouse because they're too embarrassed to chew in public. And so what is that doing to their relationship? What is that doing to their marriage? How is that affecting their own self-worth? Not so much of like, oh, I can't smile in pictures, right? Because those are relatively easy. And we certainly start with those as we're doing the teach, coach, and train with our clients and with the team members. But when you can get to those subtleties, because we learn and we see and we teach and share, it might be the patient that comes in for a consultation might feel comfortable enough with the person at the front desk that's simply saying, thank you for filling out all your paperwork online. We just need you to do this one thing. And they might lean over and say something of what I just shared. Or to the dental assistant that's taking whatever records that happen when they first come in. Doesn't matter what your workflow is. Is it a Pano? Is it a CT? Whatever your workflow is, and might feel comfortable enough on that walk back to that machine. Whatever it is, somebody in that patient journey hearing a piece of information that can be shared in a subtle way. And these are the soft skills that are so critically important. So directly answering your question, what have we seen? Being able to deliver that is really what it's all about. Sure, the pretty smile, the teeth again, the eat and the chew and the function and all of that, 1,000%, right? And we know the mouth-body connection, and now there's mouth-mind connection studies that are going on and have been published. But that's really the essence of what we do. And I remind my team of that all the time, because I haven't been a treatment coordinator. That's why we have people who have been in full arch and grown practices in that way on my team. I haven't been in operations and practices. That's why I hired in somebody who scaled, grew practices on the operations side, right? You hire that skill in, and then for me, it's really driving that culture and driving that attitude. So I appreciate that question, because I think it's critically important to identify that and not play the whack-a-mole where practices will bring in somebody who works with the treatment coordinator, works with the lead call, or works with one piece of this holistic approach that we take at G&A Consult, which I think is so critically important for those clients that do come and engage us.
That's amazing. I mean, it seems like you kind of have that figured out as far as what to do.
Figuring it out, right? Because there's always growing and learning. Patient population changes, situations. I mean, 3 years ago, money was flying off the shelf and it was cheap, right? It's different today, but we can't use that as an excuse. We just have to evolve. Yeah.
One thing I wanted to ask you is, what are some of the, as you know, I don't know what the prices are where you're at, but a full arch, upper, lower implants, we're looking at $30,000 to $50,000. How are patients kind of, in your opinion, what are some of the ways that the patient justify that cost? So what are some recommendation that you give the offices, and you're like, this is how you overcome that barrier when it comes to the financing side of the thing, right? It's an expensive thing. It's almost like you can go buy a brand new car with that money. So how are offices, or in your training, how are you setting the office in a sense to overcome that, essentially the objective of the pricing, if that does come up, and what are some of the solution that is there?
Yeah, I love that. And the great thing is that I don't, right? So I've got treatment coordinators. I'm going to bastardize this answer. And my team members that do this are probably going to laugh. They're going to listen to this and be like, really, Greg? Like, you attempted to answer that question because we know you can't. But the truth is, I do have a general understanding. And again, it goes back to the comment that I made, right? The days of simply saying, here's a third-party financing company. The APR is reasonable. The VIG, right? Merchant fees to the providers and the practices is reasonable as well. All of that is changing as money's become more expensive. And it's not so much just about sign here, pay here. And sure, it is an investment, and talking about the investment, and they don't park their teeth in the garage at night or out in front of their double wide, right? The teeth come with them forever, morning, noon, and night, to go back to that couple that I was talking about, to be able to go out to eat. All of that, yes, is 100% true. But it's more about that conversation and teaching how to not sit across from a patient as a treatment coordinator, but sitting next to them and guiding them on the journey. Because often, like you said, a $30,000, $50,000, $60,000 case isn't so much about sign here, it's $600 or $700 a month for the next 10 years. Because they may have kids that are teenagers that aren't going to get a car when they go away to college, because mom or dad made the investment in fill in the blank. It's a different conversation. It's more about, let's work through what this looks like, because it's really piecing together if they're motivated in order to move forward and see the value in what they're doing. And that's why we strongly encourage that clinicians don't talk about money. And I know there's a small percentage of population that do, and that's okay for you. We don't believe that at GNA Consult, because we just feel that it is a conflict. And that's okay. I stand by that. And also my team members do stand by that too. So I do know that piece of it for sure. And I know a little more. I'm just playing a little bit. So it is true that there's ways to be able to work through. And I've got a good friend of mine, Stacy, and she talks about this all the time, that if you get an objection, it's because you didn't build value. And it's just so true. And she's excellent at what she does. I mean, her closing percentage is ridiculous, like 70, 75%. And she works with practices all the time as well. And because of that, it's really about getting back to, as I stated, that motivation of the patient. And sure, some are just in a position where they're not able to. And that really boils down to that concept of, have you done during that lead call, right? Are you treating them like a new hygiene patient where it's name, rank, and serial number, booking them in? Or is it that you're really uncovering and discovering what is their level of dental IQ, right? How much intelligence do they have? Like, have they been to 2 or 3 consultations? So, and passing that information along, because the approach to that consultation certainly is going to be a lot different than if it's somebody who literally has no clue what you'd be talking about if you're talking about a full mouth rehab or a full arch or fill in the blank. And literally things, right? Ask the 2 questions that patients know how to ask on the phone if they really don't have knowledge, which is, how much does it cost? Will my insurance cover it? Right? Those are the questions they know how to ask. And so being able to have that conversation of, so tell me a little bit more about your dental condition. Yeah. I just want the free consultation. Okay. Like, did you want new tires on your car? Or is it that you really are coming in because you have a need? Right? And being able to have those conversations initially, and you can call it pre-qualifying a patient. Some of those terms and words like make the hair on the back of my neck stand up, because they get overused, right? And certainly there's different ways, right, to be able to bring in, narrow the funnel, and we can talk about that. But what you're talking about, right, is how do you overcome that finance, that money question? That should already be all vetted out before you actually get to discussing a price, when the patient's already in front of you, talking about what their options are moving forward. So does that make sense?
Absolutely, yeah. I think, like you mentioned something, I think building the value for that patient is such an important factor. And yeah, I mean, in my practice, that's what I try to do, at least for the patient. I'm like, and a lot of time too, I figure with people, even like No, we had a patient, like, even if they have finance issues or they're like, man, I'm not sure about this, they always call back a few days later and they're like, I'm ready to move forward. Because they're just, like you mentioned, they're just tired of the way they eat. They're tired of the teeth always have to adding this little glue inside of it for the denture to stick in and all those other things. And I'm honest with the patient. I'm like, dentures, they suck. They don't function. They don't work. We're relying on the bone. We're relying on the ridge. We're relying on all these different things for the retentions. And if one of those pieces don't work, that this denture will not function. So I absolutely think that the patients, as long as you build in that value, the money side of it, I don't think it really matters. So I absolutely agree on that. As far as the implant side of it, what are some of the, when the doctors do place the implant, are there particular implants that you like to recommend to them, as far as like which one is better than the other one, which one does it last longer? Like, are there anything that you like better than the other, or do you not even get involved in that stuff?
Yeah, the great thing is I get to play Switzerland, right? I get to stay neutral now that I don't work with any of I work with a number of the implant companies and the reps to be able to help with practice growth, right? In the lane that we work. But this is what I like to say about certain products that are in the market, right? If it works well in your hands for your particular workflow, right? It's the same debate of like, well, does 3-on-6 work better or is an all-on-4 better, right? Should you do tilted implants or should you just do this? Like, what's the trick? Well, I mean, literally, there are so many qualifiers clinically to that answer, right? Is an FP1 better than an FP3? Is it, well, what's your skill level? What's the cost structure involved? Who do you have supporting you? What lab are you using? Do you like abutments? Do you not want abutments? Do you have the, I mean, there's so many pieces clinically. Do I have opinions? 1,000%. I think some are better than others. Absolutely. But a lot of it has to do with what works best in your hands for the best clinical outcome for the patient. And there certainly are some implant brands that are more full arch specific or full arch leaning with the product portfolio that they have currently. It doesn't mean that they can't make something work. But then again, I mean, for me, like, do I want to force a square peg into a round hole, or do I really want to go with someone who is a market leader? And the reason why I say that, so if somebody is placing 20, 30 arches a month, they probably don't value as much a rep support, somebody who can come in and answer questions about parts and pieces and support. But I can tell you, if somebody's doing 4 or 5 arches a month, which is a pretty typical client of ours if they're a single location, because we work with groups and even some DSOs. If they're a single location doing 4 or 5 arches a month, they want to get to 15, 20 arches a month in the next year, right? So they're going as an accelerator and really bringing us on in full bore. One of the things that really needs to happen when you look about optimization of the most expensive thing in the practice, the doctor, is that he can't be multiplied necessarily, but moving him into a lane where he's doing the surgery, of course, but then some of the restorative work being done by an associate or another individual, and also including that individual in the consultations, right? In the consultative process of talking about the clinical aspect. Well, in that respect, having an organization that is your implant provider of really well-skilled, active, on-site, participating, that has a lot of skill set and has a lot of curriculum that can help to lift up those individuals is going to be really valuable. So I didn't want to start by saying, well, it depends, but it does depend. What is your particular situation? So that's some of the things we do at G&A Consult is take a look at, here's the 18 things that we support you in. And then where are you on the need and want list? What's most important to be able to get you to the next level in the quickest possible manner? That's a system and process, not a people dependent or a person dependent, but a process dependent. So once you've actually taken the tools and learned them, that it actually starts to run on itself and it's scalable. So that if Susie decides that, you know what, actually, I'm going to start a family. And so I'm not going to be able to work 6 months from now. The whole thing doesn't crumble down and you've got to go and spend that type of situation. Or they see, grass is greener on the other side. I'm going to go work for Dr. Jones across the street, or fill in the blank, right? We've seen this story play out over and over, which, by the way, if she's going to go work for Dr. Jones, that's fine, because we know that we actually tie base, variable, tie it to profitability. So actually, as the arches grow, it's not a static thing, and the fluctuations, all the things, that's the operation side of what we do. So this is what's critically important in order to have the success. Let me say, have optimal success in practices that we know. So it's not just the tools in armamentarium. So it's not just like, oh, your P&L statement, you could save yourself a nickel over here. but don't save yourself a nickel by stepping over dollars for the support that you need, because we take that holistic approach. And that's why it's customized approach. Just like with, we say that, scripts don't work. Well, they kind of do if you go to base camp, right? If you're going to basic training, that's okay if you're an Army grunt, but if you're going to be in a $2 billion fighter jet, you probably want more than basic training. And that's where customized to their practice, building their own LMS platform that we provide to them and work with them on their differentiation factors, being able to compete with the guy down the street. Maybe those big box stores that moved into your backyard and are taking a bigger chunk of the pie that you used to have, how to compete with them. Those are the pieces that we think are most essential in order to have the best chance at success with your individual practice or group.
Yeah, that's amazing. I mean, I'm sure that, when it comes to, I remember I was talking to one of the doctors, he's a friend of mine in Nashville, and I was talking to him about the full arch. So when it comes to the, like, because at my office, we essentially just let the patients know, hey, like, we don't make them a temporary one. We just tell them, hey, we're going to give you a denture, and then we'll turn those denture into your implant dentures once. So when the offices, how's that the temporary implant process look like? Typically, what company do the offices use? Do they have to have lab pre-make those temporary and send it, or are they made in the office? How does those typically work?
Yeah, I mean, there really is a whole myriad and array of opportunities for them to be able to select from the very beginning. And if they're new in the process, really being the only rookie in the room, back to that triangle of success, right? And that would be the lab, right, that specializes in full arch, the implant company that specializes in full arch, and then a doctor that's new, be the only rookie in the room. Now, when they become very well skilled, they're the expert, right? Then they can maybe have a rookie on other sides, and that rookie might actually be the lab and bringing it internal. And we have that conversation. So going from a completely analog workflow, or what I call outsourcing, sure, your cost and expenditure would be much higher and your margins lower. However, you want to make sure that the outcome for the patient is great, right? Most optimal, because you don't want to go through 3, 4, 5 prototypes after you have them in some type of temporary and you're trying to get to a final, because you're chasing after you're chasing after the bite. That's the worst case scenario, and that does happen. And then slowly working your way to, in a very measured way, and we do this, as a matter of fact, we have 3 or 4 clients that are slowly gravitating towards a fully digital workflow, right? And so that can be where they start using, something like digital arches, OptiSplint, or eventually to photogrammetry, and then printing their temporaries in-house. And that doesn't mean they have to bring a lab tech in-house. It could be like a really well-skilled and motivated dental assistant, right? That's why having the P&Ls are so critically important, to see what is your profitability, and as you build and grow, to make sure that your margins continue to build and grow in arches. Because once you get past that 3 or 4, then the margins on each arch start to really increase significantly. So we guide them, and we've already vetted industry partners that can really help. And it's not, you need to use this one. It's, here's some options. Who do you have for as far as staff? And again, it goes back to, what's the most important lever right now to be able to increase your profitability, to increase your arches now? And then what does it look like for the runway for 4, 6 months from now, 8 months from now, 12 months from now? Because that's a whole different conversation than what a lot of consultants that are out there, let alone those that are focusing on full arch. Because so often in the full arch game, it's well, I'm doing 4 arches, I want to do 12. Okay, how profitable are those 12 arches that you want to get to? Or are you just throwing money at it and hoping that it works out for the best? Well, if you also have a thriving GP practice, which most of them do that are profitable, taking those profits from the GP side and throwing it away into the full arch side, that can be really painful. And so many conversations we've had are exactly that. And it hurts my heart to hear those stories, but we've heard it over and over again. And that's really where doing it in a measured way to be able to achieve the goals, that's why we do the consultation, right? We do this discovery calls with any of our clients. They're complementary, right? Let's have a discussion about, where do you want to get to? What's the realistic goal? How does it look like to get there? And here's what we've done for clients that are similar to you, because you can kind of categorize them together. They're all custom approaches to it, but they kind of fall into certain big buckets of categories. And that's how we approach it working with them. So it just depends on where they are in from completely analog, right? Where it's a retrofit of a denture, like you shared in the beginning, which is a true analog, how they all were done 10, 12 years ago, to a completely digital workflow where there really is no wax up, no nothing like that. And we could talk about that having in-house, not only to print temporaries, but also to mill, zirconia, to mill bars, which, clients of ours have those as well. And every step in between of who can you and will you use? And there's options all along the way that we know partners that are really well vetted and really well skilled in what they do, for sure.
That's amazing, Greg. Besides the technicals of the job, I'm going to ask a few cliche questions that you probably get asked a lot. You started this 3 years ago, correct?
About 3.5 years ago. Yep.
3.5 years ago. What is this your very first business that you're starting?
I mean, we could go all the way back to when I was 10 years old and picked up a paper route, back when you actually picked them up from a station and then dropped them off and collected door to door. Started with 72 houses on my route and ended up with 195 within 3 years at the age of 13. So no, I wouldn't say it's my first business venture. It's the first one, though, as an adult. Well, again, I don't know that I'm adult. I still act like a kid sometimes. Very, very childlike. Sometimes childish. You could ask my friend Sarah Ruberg. I'm kind of childish at times, mostly childlike. But yes, first venture into having my own entrepreneur, having payroll, going through all the tax stuff and being like, wow, okay, so this is what owning a business is like. Yeah, so I've really leaned on a lot of mentors who have been very generous with their time and giving me some advice along the way. And I call them learning opportunities, not necessarily mistakes. And it's interesting how, doing this for clients and saying, oh, maybe I should do that for my own company, and learning along the way. It's been good learning for sure. Yeah.
That's great. And it's so interesting how you have a story for everything you want to say. Now, that's usually how I try to approach things, but sometimes I fail. Majority of the times I fail. So about
people
that,
remember
Greg,
stories. They don't remember the yakety yak in between. Like when I just told you about the story between analog and digital, they won't remember that path and journey. They'll remember a story in it for sure.
Yeah, definitely. So about that, a big part of your job is networking, correct? And I can say that you probably didn't have a hard time to find new networks and, make connections with people. How'd you find that?
Yeah, it's
Am I
interesting you
right?
say that. Well, it's interesting you say that, because when I transitioned from what I'd consider the manufacturing side, right? So for 15 years, I worked for one company, and then for, a good 8 years for Strawman Group Neodent. It's different than when you transition into working for your own company and trying to network in that lane, right? So was it difficult? It was a grind, right? Because you're reaching out to people, nobody knows who you are. You're trying to define what your product offering is. You're trying to figure out which conferences to go to. When you're introducing yourself, you're trying to get your elevator pitch down. And what I found to be true that was really effective early on was asking other people when I got to meet them, what can I do to help build and grow and support your business? And then, interestingly enough, even some of those early on who did reach their hand out and were offering to help, as time grew, interestingly enough, and it's not most and not even like a ton, but a small percentage of them, I look at them now and I'm like, but now you're kind of like an evil bitch. Like, I don't understand. So you don't have an abundance mindset. You think that there's a limited pie and you are the only one who deserves to have this lane. Could we just see that the pie's ever growing? And like, if you do have the best product offering and people that are in your same lane, I was with my mastermind group a few weeks ago on a retreat, and literally there were 3 people there that do revenue cycle management. They weren't fighting. They all had abundance mindset. Literally, one of them, who was much further along, sat down with the other 2 and was opening up the playbook and showing them everything. It's the same for me, right? I mentioned Stacy Pfeffer Farley. She does very similar things to what I do. And we are good friends, right? We share. We literally were just a sharing space in front of the Neodent leadership team, I don't know, maybe 3-4 weeks ago, right? Sharing with them our perspective on the industry landscape, how they can position, because they are the market leaders in full arch and those things. And I see her speaking at different events and I'm at those events and vice versa. So that networking piece, did it come naturally? Kind of, sort of, because I am, I'm an outgoing person, but it can also be very draining. There are times, I'll admit very freely, I was at a conference earlier this year and I had nothing to give. So I was there, and maybe 2 or 3 hours I did like the networking Greg thing, right? People know me for taking pictures, selfies, posting it, right, and interacting. But the second half of the day, I literally had nothing left to give. And I did. I like went into a shell. I stayed in my hotel room. Like I got some work done, which I can always have work done to get caught up. But some of that people don't see. And so I've been trying to share more of that in my story. And I'm sharing it very openly here as well, but even on socials, and saying, sometimes I'm just drained, right? This is the good, the bad, and the ugly about start your own business, they said. It'll be great, they said, right? Good luck, like figuring out like taxes. And when you hire remote workers in different states and you have to file it, and I thought like it's normal to pay $400 to another company to file and get your state filings in there. And somebody comes along and says, it takes like 10 or 15 minutes and it's pretty easy. I can show you how to do it. And it costs like nothing. And you're like, how much money did I just waste? Back to your point, though, of like the networking thing, yes, to a point. And then you're trying to decide, well, who in this vertical? Because you don't want like 5 different verticals of people who, sell telephone services that you're recommending to clients, because that doesn't seem like good in integrity and doesn't feel good for me. But which one do you choose? And so you start to develop along the way. I always like to say there's 2 sides to a relationship, right? They don't call it show friends, they call it show business. So there should be something in it on that side. But also now it's all about building and growing business together. Like, what can we do to co-promote and co-market each other? And what does that look like? Is it blogs, podcasts, socials, interactions, introducing each other to friends, family, neighbors, uncles, mothers? So that's evolved, though. Doesn't necessarily happen naturally. Early on, it's putting myself out there. And like when people would like cancel meetings or postpone meetings, I would get so offended like 2 years ago. I'm like, how dare you? Now it's happening all the time. And I'm like, oh, I was that bitch. Oh my gosh. Now I've turned into that. I'm that guy. Right. So I'm always very careful with like team members of mine now that I have a pretty team that's growing, right? 8 of us. And I tell them, look, Maya Angelou said it perfectly. And I'm going to paraphrase, right? People will forget what you said. People forget what you did, but they'll never forget the way you made them feel. And that goes back to like the jokes and the, having a good time. They'll never forget the way you made them feel. And so when I miss the mark and people don't feel good about it, I've learned, right, being sober 20 years, and no, I'm learning being sober 20 years, that it's okay. You can make amends. You don't have to be perfect. You just have to make a course correct and then act differently moving forward. And that's really part of it, like about the networking thing, where some people see me, they might have this impression of me, and I'm sure it annoys some people, and that's okay. 20% of the people I'll never make happy, and 20% of the people love me pretty much no matter what I do, and move the middle. As long as I'm being my authentic self, that's really what it's all about. But sure, getting out there and doing that. And people that I consider friends, I'm constantly thinking, that and that go together. Let me make an introduction, right? And doing that warm handoff, and not just like the email, but really being intentional about this is the why behind the what, right? Just like I share team members, why behind the what, clients. Like if you don't know why we're implementing this tool, ask, because we want the buy-in. We want you to understand why there's a tracker, why there's this metric, why there's this tool, why we want you to do it this way. And it's the same with relationships and introducing people. I think it's critically important to be able to share that and have the psychological safety to ask that, right? Because that's what you would want. I was going to say family, but I don't like all my family. I have to love them. But, but that's like with friends that you choose to spend time with. There should be that for sure.
That's great. It couldn't be more descriptive than that. I mean, I had a bunch of questions that I was going to ask you after that, but you answered all of them. So, Greg, me and Milad,
I've got your crib notes. I can see it. He shared, Milad shared all your notes with me, so I already know your. I'm just kidding. He didn't.
I wish we had
Milad,
some
you let
notes,
him
man.
into the back.
Right.
So, how about this part? Did
Over your
Milad
shoulder.
share this part with you? So, when we started this podcast, we started doing it differently. On some of the podcasts, we do role plays, and some of the podcasts, we just have a round of yes or no questions. Have you seen that, like on the shows? That they just ask questions and you either say yes or you say no?
Yep, I have seen it.
Okay, shall we
I
start with
actually
that?
watch. Like, if I'm going to be a guest on a show, I at least watch a couple episodes so like I'm prepared. Like, y'all ain't going to catch me with my pants down. That's a whole different podcast, and you don't see that. You have to. There's a paywall for that, just so you know.
That's
Hey,
okay.
girls got to eat. Just
We can go on OnlyFans for that one.
It's
It's not
always funny when
OnlyFans, it's fans only. We flipped the words because it's a different platform and most people don't find it right away, and I don't want to be searchable. So you got to be careful. Now, when you network a lot and you're out on socials, you got to be a little more careful, Milad. Just saying. As you kind of work your way through this, right? That's a little bit of free mentoring right there. Just saying.
Well,
So is that
thanks
a
for the
side
wisdom.
business?
It's just my feet. People said I have pretty feet. Watch now. At the next dental conference, people are going to be looking at my feet. I guarantee it's going to be a thing. I
Great.
open up a whole can.
I know. People at the conference is gonna be excuse me, can you take your shoes off? I want to see your feet.
I'll wear sandals. They'll be like, why is he wearing his Jesus sandals? Don't ask. It's a whole thing. It's a promotion thing. He's trying to get more views, more subscribers. Oh, it's been a tough Q1. He didn't bring on enough clients. He's bringing on too much staff. He's drowning.
Well,
I told you it was going to go off the rails. Eventually, I held it together as long as I could.
well,
Dude, that's all on you, man. That's all on you. You started this thing.
I told you, Master always does this to me. When like in
Massive.
halfway
Come on,
through,
man.
No,
I'm like,
it's always
Master,
funny to
come
catch
on.
people off guard.
Right.
That's the surprise is the interesting part.
Well, Master, you said ask yes or no question. So, Greg, I have a question, yes or no question for you. Do you like Sarah?
Do I like Sarah? She's gonna watch this. I have to say yes.
No, please, honest.
I think Sarah is one of the most genuine, authentic people that I know. Yes, the answer is absolutely yes. If you could slide into our DMs on Instagram and see the Taurus memes and gifts that we send and the videos we send back and forth. She's a Taurus just like me. They're so spot on. So spot on.
Yeah, no, we I don't know if you know or not, but Sarah is a co-founder of mine with Dentment, and she's a chief marketing officer at Dentment as well. She's amazing. I love her so much. She's truly authentic. We have so much fun every time we get on our meetings.
Yeah.
We're laughing for like 30 minutes, and 5 minutes is the meeting.
I mean, so I actually, well, great story. You're talking about networking. I met Sarah virtually first on LinkedIn. We had some conversation, and then I met her in person. And I think it might have been at no, it wasn't Women. Maybe it was Women in DSO. It was either that or it was the AADGP meeting 2 years ago in person. Because the first year I was kind of stealth. I didn't really go to the conferences. I mean, poor coal miner's daughter, right? Ask Loretta Lynn. I mean, I didn't like that wasn't like my strategy initially. And she was so kind when I met her, and so she was just a wealth of knowledge. Yeah, and she's great. So yeah, short answer is yes. Wait, you said I'd answer yes or no. Boy, did I not answer yes or no on that one. Breaking the rules, breaking the law, breaking the law.
It's all good. We don't have no laws here. There's no laws here. But Mr. Gary, what do you think? I mean, how are you? So, I mean, this is an interesting question that I wanted to ask you. With the full arch, how do you think that the AI is changing the landscape? Do you think that the AI is even contributing to the full arch? How are you using it? Does it do anything?
I'm asked, yeah, it's a great question because I'm asked this often and clients are asking this for sure, and we're having conversation. Here's what I believe. So AI enhances the human experience, and especially in full arch, again, and I'll go back to it, right? So it's the why behind the what, especially in full arch cases. And AI really it consumes information. Right. So when you're talking about, analytics of data, for example, if it has 250,000 pieces of data that says tooth number 23, when it looks like this is how it's diagnosed. So that it can anticipate when it sees tooth number 23 that looks like this is what our analysis, this is what the treatment plan is for it. When you're talking about full arch, and so certainly when you're talking about like for front desk, or you're talking about doing appointments, or you're talking about here's the chief concern, all of that, yes, absolutely. It's getting better and better and better, right? And I actually have a company that I've been working with on this, and we've been working on the full arch side. The challenge is that there really isn't this script or formula that there's enough data input for AI to get really good really fast. Like, for example, like on empathy. And they've been working on this piece too, because empathy is so critically important, right? Of making that bond and connection. If I were to say, this is not actual numbers. If I were to say when it comes to diagnosis in treatment, that AI right now is about 90% competent. It's not, right? But I'll just say that. Then if for being able to do front desk basic scheduling appointments, things of that nature, rebooking, let's just say it's like at 70%. When it comes to full arch, even scheduling full arch and show rate, because who cares if you can book an appointment? Can they show up, right? Making that emotional connection. And we can talk about like this system that I have that's being trademarked. And until it is, I'm not going to tell you what it is unless you're a client of mine, but that's okay because it's IP processes in play. It's got to be like maybe 35%. There's just not enough input of data for AI to become really competent in that area. And then when it comes to like consultations and that, very low. It's just not there, even with data input that's coming in. It's not that it can't get there, it will. It's kind of at the lowest level of getting there because it will. And I've seen some other treatment plan enhancement tools for other treatments, and certainly it's well advanced compared to it is in the full arch lane. And as much as we're working on it and trying to get there with it, and I've seen a few, there's still a really long way to go because I think there's so much subtlety to it and there's so much of the motivation, not the clinical outcome. The clinical outcome piece, certainly it is much higher, it's much closer, but the clinical outcome is not really the piece that motivates people to say yes and move forward when it's such a big investment, which you smartly pointed out, right? It's such a big investment that, it's like a new car, right? It's a big obligation. So it's not really the huge motivation behind getting people to say yes, right? How to move towards a yes, right? Case acceptance and, which is all about patient experience. And that's something that I talk about too.
Yeah. Well, we were talking about AI. I was like, Mr. Craig, we may want to watch out because Masood is in the AI business. He's a CEO and founder of Allo AI. He's in the dental reception business right
Actually,
there.
about that, Milad,
Maybe Masood, you should work with Mr. Greg, come up with something.
I messaged him twice and he ghosted me early on. So why is that, Mr. Greg?
That's not true. That's not true.
That is very true. I can share my screen right here on the podcast.
Share the screen right now. Kidding, pull it up. See? Because I wouldn't do that. Because people have done that to me. Like, people have done that to me. I think that's like seriously, I think that is worse than actually like being rude in a turn down is to ghost somebody. It's like, I understand you get busy, right? And here's the thing, you said twice. Like once I get like, people get super busy, have the best intentions. Maybe they read it and like, somebody called and, they're putting out a fire like with a client. I get that. But twice, it's like, come on, man. Really?
No, I'm just
Let
kidding.
me tell you a story, right? Because I've got tons of stories. So Guillaume was the head of North America for Straumann Group. If you sent him a message, now at the time, and this was back in, I might get the numbers wrong, 2017, 18 timeframe, 2019, before he got elevated to being the global head of Straumann Group, right? And took over for Marco Godola. This man, he had at that time 1,800, 1,900 employees in North America. If you sent him an email, within 48 hours, maybe 72, but within 48 hours, 99% of the time, he would answer your email, not with a quick, got it, noted, thanks, let me pass it on, but with like a really sincere, thoughtful answer of like at least a couple of sentences. How many thousands of emails do you think he received in a week? I mean, this is where I learned people will never forget the way you made them feel. He was very critical of me, which I realized he just saw a ton of potential. And so he really elevated me. So I have to lift him up and thank him for that, right? Because he really did see the potential. And that's why he was, critical of me in areas that, looking back, I totally deserved. Like, it was really just trying to elevate my game, which he did. And I give him credit for. But I say that because, come on, you're not that busy. You're not that important. Now, I like to think that I'm that important at times, but I don't do that to people. I just don't, right? I'll respond back. Now, I'm not talking about like the spam of like, dear GNA consult. It's like, okay, at least try. Would you like a list of 37,000, chiropractors and, and I'm like, come on, man. And then they'll send another one follow up. Just bumping this up. Hope you got my message. Come on, man. Like, seriously, like just because you have an AI just to call you out, just because you have an AI blasting out 30,000 emails to try to get 2 drips of a cold to a like lukewarm lead. Like, no, that's not happening, right? Block. But in general, certainly. And I even go and I check my spam box once a week just to make sure if anybody slipped through the cracks somehow because it just didn't come through. I do. Like, I think that's critically important to be able to respect and honor people's time, right? And that's something that I do. There's individuals right now that I am mentoring in a formal way who are coming up the ranks. And it's not like, oh, let me give you a handout. It's not. It's a hand up. because people did that for me. And what I found is this industry, this dental industry, is rich with individuals like that. The vast majority. And, you know, my good friend Margaret McGuckin said, and I had her on my podcast, gosh, I think she, like somewhere like in the first 20 episodes, she was a guest. And I close every episode with, is there anything you want to share with my listening audience in the last few minutes? And she said, this is an amazing industry. Don't be afraid to reach out, because people are always willing to help. That has rung true, and it literally rings in my head constantly.
Told you I was
And for
gonna
someone
throw
like
that
her,
in
who,
there.
you know, she was the founding COO of Clear Choice, and we've done work together, and she's amazing. For her to lead in that way, and just, it was such a beautiful reminder to me that that is the way that I want to represent myself. And, you know, I built a good name in the industry, and I want to continue that. That was just a beautiful, like, corner piece to the jigsaw puzzle of saying, don't ever lose that. Don't ever get too big in your own mind that you forget that. So that was really wonderful when I heard that, and I carry that forward and lift her up for that.
Master,
Greg,
you
I
hear
think you're
that?
gonna have a lot of spammers on your LinkedIn tomorrow. If you don't respond to them, they're gonna be like, Greg, well, you just said it. How can you not be loyal to your own word?
They're gonna come on Dance Man
You're a
podcast
big
and
fat
put Greg.
liar. That's
Master,
okay. I accept it.
we should make a fake account and just message Greg and then just put him on blast.
Do the ping, 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 ping.
Hey man,
Why
where's
do I
my
have
response?
4,700 emails? It's like, wow, did that go viral? Like my friend Laura Brenner, hers did. But it's like somebody put like in a blog, I think it was like 12 years ago, 10 reasons why I hate going to the dentist. And she just flippantly said, 10 reasons why the dentist hates you, right? Or something like that. I forget the exact name. Forgive me, Laura. And that's really where her side gig came from, and the response. And there was such a need. And now she has dentist side gigs as a Facebook group and what she does for a living. And she's just a beautiful soul. She gave me a great exercise. I don't know, it was probably like 4 months ago, and I've known her for a little while. And she had me write a letter called Dear Greg. And it's a letter to myself of what does it look like a year from now in your personal life, your professional life. And it was such a great exercise. And honestly, like another, in my mastermind group, we did it as well, like 3 weeks ago. And I'm like, I'm familiar with this exercise. It's such a beautiful exercise in a way to frame it. But yeah, that's what it reminded me of, just being like, being authentic and being true to yourself, envisioning what it could be, and also being like, you know, hey, don't be afraid. So yeah, if I have 4,700 emails, you know, and this goes viral, I'm okay with that.
Well, Mr.
All right.
Greg, you know, Masood always knows this. You know, whenever somebody comes on our podcast, we spend about an hour together, man. I feel like I've been knowing you for my whole life. You're very super personable, and when I ask you, you send me a text with your phone number. You have been super kind to me, and I truly appreciate, what you do for the industry. I think that the one thing that dentistry to the side and working with the patient, the one thing that I loved and enjoy about the dental industry after dental school is just the people that I have met along the way. And I think that for me, it's such a like powerful thing to see like how much passion that you guys are putting in as much as that we put in as a doctors, because we have to have a passion to help the patient. I mean, the fact that you guys are providing the services that you provide and giving us the ability to serve our patients, I think is such a game changer for the dental industry. So I truly want to say like, thank you for what you do. I mean, I think it's such an important thing for the patients. I mean, firsthand, I can tell you, we put those implants in the patient's mouth, they get their denture, man, and it's life changing. You see people's life just change in front of you. So, I mean, some of this stuff wouldn't be possible with you guys. So that I truly want to say thank you so much for what you do. It's very important. So
Well, I appreciate those kind words, and I receive it. And what I can share is that we're better together. Those that provide service to you, the clinicians that are on the front lines working with the patients, and when we collaborate, there's nothing we can't do to be able to elevate patient care and to be able to provide better products, services, and outcomes for patients, especially in my lane, in the full arch lane, as we see that 10,000 human beings are reaching the age of 65 every single day. And that's projected to happen through 2030. I mean, this is such a critical piece to be able to provide access and service of this nature, to be able to give patients back, their pride, their dignity, their ability to eat and chew. There's so many people, I think it's estimated 33 or 38 million Americans are edentulous, at least in one arch. I mean, there is a better way than either being edentulous or having a flopping around prosthetic that nobody wants and nobody uses. So thank you for giving me a platform to be able to elevate what we're doing at G&A Consult and doing what you're doing every single day of providing that patient care on all levels. So thank you for that.
Thank you so much, Greg. It was amazing. Actually, you made my job a lot easier because sometimes, once in a while, we bring on guests that are a little bit boring. Like, that they are good, but they try. But, we still have to spice it up and try to, make it really funny to make sure, the audience are going to love it. Because that's what it's all about, being funny, having fun, sharing that positive energy. So thank you so much for coming on and being funny and sharing your whole story with us. It was amazing.
Of course. I hope that like when this, as it airs, people have like scorecards like they did back like on a scale of 1 to 10. And it was always that Russian judge that would give like an 8 so the American would never get the gold. So I hope there's like flashing of cards of like the score of how Greg fared on the podcast. I'm open to it. So yeah, if you're listening guests want to score how I was as a guest, I'm okay with that. I'm totally okay with that.
That's a good idea. We should do that, man.
Yeah. I'm down.
Make a poll for every podcast.
Do the rankings, back rankings like they do as salespeople. I'm okay with it. I'm down. I'm down. Count me in.
Well,
no, I appreciate it.
You are on the top of our list, Mr. Greg. I really, truly appreciate it. Thank you so much.
You say that to all the pretty girls I heard.
That's more like Masood. That's Masood's department.
Yeah, that's more like my
Because he's the player. He was trying to pin me down at being the player. Now we know. Now we know where he gets it from. Called out.
He's the one that takes people down the dark alleys, not me.
You want a piece of candy? Yeah. Windowless fan and a piece of candy. Got it. When I see you at a conference, I'm gonna bring a buddy with me. A buddy system around you, sir.
It takes you down the alley with the ice cream, so you gotta be careful.
Yeah, but there are a lot of surprises in the dark alley. So whoever comes on it,
I bet
they always have fun.
Man, we're ending this in a weird way.
I mean, it was kind of this whole Bathin journey. So I mean, you might as well close it the way that you were winding. I mean, why be all prim and proper now? I mean, it wouldn't be authentic.
Hey man, I'll go. Me and Masood will go down any alleys with you, Mr. Greg, so don't worry.
I love it. We're gonna link arm in arm and take over every alley in dentistry. I love it. The three of us, the three musketeers. I'm down.
And now and also we need to start doing that, fan only for everything else. So
I'm telling you, yeah. I mean, we have initiatives. This is on. We're doing it.
All right, Mr. Greg, thank you so much.
Very good to see you. Thank you so much.
Thank you so much.
Thank you for your time, gentlemen. Be well.
Thank you. You too. Bye-bye.